remains a global public health concern and a leading cause of death worldwide, accounting for nearly 10 million deaths in 2020, or nearly 1 in 6 deaths. Coupled with a significant out-of-pocket healthcare spending in the country, the majority of Nigerian cancer patients pay for their care without financial support. At this 6th annual General Conference of the Association of Radiation and Clinical Oncologists, Enugu State Governor Peter Mba decries the extreme hardship patients with cancer-related illnesses go through in the country.
When we talk of cancer and associated issues with it, the challenge the patients face, the drain on the life of families, the pains those close to them face, nothing should stop us from any investment and effort needed to find better ways to care and ensure that people get out of cancer problems.
President of ARCON explains that the theme of the scientific conference, which is equity in oncology, patient practice and policy.
Our meeting objectives are to facilitate collaboration between policymakers, healthcare providers, and patient advocacy groups to promote equity in oncology at both the local, regional, and national levels. We also aim to identify barriers to equitable cancer care, propose innovative solutions, educate attendees on patient-based advances in oncology research and technology, and conclude with an action-oriented plan for evidence-based equitable practices.
The gathering also provides an avenue for oncologists to show solidarity and equity in the practice of caregiving.
When we go into the city, when we implement what we are doing, when the government raises their policy, they'll be able to address those gaps so that in the presence of midst of a lot of things happening in the world, that the low person, that the simple man in the street will not be prevented or blocked from accessing the best of care in that environment.
Others at the event say Nigeria urgently needs equipment and necessary facilities for cancer management.
As a matter of fact, there is no doubt that we need private participation. In all the while, let's consider the existing private cancer centers in the country. They are mostly owned by government. But recently, we brought in private partnerships. And that is, with private partnerships, some of these treatment, the machines are being maintained and treatment is being sustained. Unlike, for example, I can mention a few centers. Let me use UNTH, for example. When we are solely being handled by government, our machine will spoil. It will take time, months, to even repair one. But now, with the involvement of a private entrepreneur, who have a meddling company that are joined, that is maintaining our equipment. And as a matter of fact, the company has bought a new equipment and then it's been maintained. Since that, I will be having steady radiotherapy service for the poor people.
These professionals here say cancer is everyone's fight and beating it will be everyone's victory. So while these steps remain commendable, there is, however, a huge gap to fill by the National Health Insurance Scheme in the provision of adequate coverage for cancer treatments in Nigeria.